so I'm Nicola Henderson. I'm a dietitian by trade, and for the last 2 or 3 years I've been working as eHealth lead for AHPs in addition to my own job, and that's in NHS Forth Valley. And it's a year ago, yesterday, that I first met Euan on the leadership course.
Yeah, I'm Euan McComiskie, a physiotherapist by trade, qualified now for just over 7 years, and then managed to get a seat at enough tables that I managed to get myself a half-time job as AHP Informatics Project Manager, and did the eHealth leadership course with Nicola and with others a year ago. I guess I was living in a wee kind of isolated but safe wee world of physiotherapy in terms of eHealth, so I had an awareness of the bigger picture, and then joined the leadership course to get some different and kind of alternative ways of approaching leadership, but also opening eyes to the bigger picture, you know, regionally, nationally, and to a certain extent even kind of, you know, worldwide. And the course gave me the confidence that, you know, to be able to start looking at the bigger picture, rather than just my little physiotherapy world. And then meeting different people like Nicola from different boards and different professions opened my eyes further to actually looking at how things work for other people. And again, yeah, that gave me a kind of a trigger to start the AHP-wide, Lothian-wide work.
So with myself, I was already working a little bit with eHealth. I had some ring-fenced time, but just a little bit of time through NHS Forth Valley, but I also was working as an AHP Team Lead for a team of physios and OTs and rehab assistants. And for me, I was looking for a leadership course, but I also still wanted to be working with eHealth, and then this course came along and I couldn't believe my luck, a combination of leadership and eHealth. So that was one of the reasons that I did the course. AHPs are really, really good at is innovation, and we have to think differently. I think because whether you're a dietitian or a physio or any of the other AHPs, so much of our job is about behaviour change, isn't it? And we have to come up with those different ways of engaging our patients to do what we need to do, and perhaps changing behaviours of a lifetime. And I think that's when we can really bring those skills out in helping change the ways of working, whether it is moving from paper to electronic records or using technology in a more innovative way. I think we can really be at the forefront of that. Yeah.
And as the clinical experts, we can help to drive the non-clinical experts, the tech guys, to create those innovations for us. You know, we can be quite descriptive of what we need and what we want, and then they can hopefully make it happen.
That's right. In fact, I think that's another good part of our role, is that we are still clinicians at the end of the day. We still have clinical caseloads, so you can still be on the ground, at ground level, doing what you do with patients, but looking at that strategic point of view and looking at what do we need to deliver and working out how to do that, but still keeping your feet on the ground. Ultimately, we can deliver better care to patients. And as you said about this expectation now of digitalisation, patients want technology, don't they? They want to be able to go to their GP practice and just log in for their appointment instead of waiting in a queue to say that they're there, or they want to make their appointment online. And we can really do that with AHPs and change our services to meet the needs and the expectations of a lot of patients now.
And I think that, you know, we always hear about the new workforce coming who are tech savvy and who are keen to use technology, but actually they're here, they're us. You know, we all have an expectation of being able to use handheld devices and Wi-Fi access for hospitals, and we have that, but so do our patients. So, you know, I have 90-year-old people coming into the ward and asking what the Wi-Fi code is so they can use their own devices, you know, in the ward. So it's not a new thing. It's become normal.
one of the good things about the leadership course was actually making us use the technology, so not just showing us the technology that was out there that could enable practice, but actually getting us to use it. And I think that day 2 of the programme, where we were all working in our own environments, but we were talking to each other using video conferencing, and then we were sent away for an hour that we had to use Twitter, and that was really good, because not only did it make you use it, it got you thinking about how could you use that in your health board with your AHPs and other professions as well. So it was the doing, wasn't it? It was very much enabling us.
Yeah, and I think that was the first time I'd ever, you know, dialed into a bridge for a VC on that day, and now it's the norm.
That's
so
right.
it's challenging what we're doing.
Well, look at today. I'm walking up the road and you're tweeting saying you're already here.
Yeah, so it is, and it becomes normal for us, and it becomes the conversation, and the continued learning of the programme is online, is virtual now rather than face to face as much.